Hello. There. Should I get a little centered? There we go. Yeah, good morning. Next question. We're finally to today's questions. Oh my gosh, I'm almost caught up to reality. Fantastic. This one's from Linda. Good morning, Linda. Purely out of curiosity, my children have either been immunized against or had the common childhood viruses. Yeah, okay. And thing is, even if you don't know it, every kid has had what is it? Four different kinds of coronavirus by the age of 5. Just statistically, you can look in kids' blood, and people haven't. Yeah, everybody's had it. You didn't know you had it, but you had it. Not SARS though. Yeah, that one is one that you usually know it if you get it. Yeah. So how will this lockdown affect the spread of childhood viruses such as chickenpox? Yeah, great question. Yeah, this is going to drive, I think, a whole bunch of viruses straight into the ground. Our first real big test, though, isn't going to be until flu season because that's a thing that we track and that, or at least that I'm aware of tracking. I'm not sure if chickenpox has a season. I feel like that's just a thing that goes around the world and just keeps growing. But it's possible that it does. But common colds, which are a whole bunch of different viruses like rhinoviruses and pneumoviruses and metapneumoviruses, these things are probably all going to be much lower this year thanks to the mask wearing, the social distancing. These are all things that are spread by respiratory droplets. And when we've been walking around all these years just saying, hey, hi, howdy, neighbor, how do you do? We've been spreading respiratory droplets along with our little message of good morning or hope or whatever. And that's how these viruses have been spreading. Uh, yeah, yeah. So let's see. Unfortunately, I suffer from irritable bowel disease, and sickness bugs can cause me to flare up. Yeah, okay, that makes sense. So I also have the kids washing on their hands. Good, you should, as soon as they come home from school. I'm hoping that one uptick if of lockdown will be fewer sickness bugs. Yeah, yeah, and that should have less of a chance to spread. Totally. The other part of this is that an unknown portion, it depends on which modeling study you're looking at or which little pile of data, but we tend to look at adults and say, oh no, adults are getting sick. But the question is, how do adults get sick? And the role of children in getting adults sick is, I think, not completely worked out, but probably a whole lot bigger than most people would realize. And so switching to child isolation, that may be actually the biggest component driving down the numbers of flu, cold, diarrhea, rotavirus, what have you cases. Yeah. At least for people that are able to socially isolate. Now, the ones that aren't able to socially isolate because you have to go to work or because you're at work and the kids have to go somewhere while you're at work, stuff like that. Yeah, for those people, there may still be some risk, and I think we'll see kind of localized little pockets of transmission. But yeah, overall, like on a USA level, on a world level, there should be a lot less of a whole bunch of different viruses, and that's kind of neat. Yeah, in fighting COVID, the things that we do that will eventually beat COVID may end up beating a whole bunch of other viruses at the same time, and that would be fantastic. Yeah, because they're neat things to study in the lab, and there's plenty of them out there. We don't need the ones that make people sick, is what I would say. We've got a world of other viruses that we can all explore together without getting sick. Yeah. So, yeah, thanks very much. Interesting question. This has been Ask Dr.